I'm Kevin Bales, principal of East Hall Middle School.
Hi, I'm Dr. Dave Westfall. I'm the District 2 Public Health Director. My responsibilities cover not only Hall County, but the 13 counties in Northeast Georgia.
I'm Betty Guilfoyle. I'm a licensed marriage and family therapist, and I'm the Regional Director for VITA Community Partners in Hall County.
My name is Scott Ware, and I'm a lieutenant with the Hall County Sheriff's Office.
I'm Shelley Davis. I'm Vice President of Existing Industry at the Greater Hall Chamber of Commerce. I also am the Drug-Free Workplace Coordinator.
My name's Cleve Brown. I'm a pharmacist and I own Corner Drugs on Thompson Bridge Road. I've been in the retail drug business since I was a teenager, actually, since 1969.
I'm Jeff Black. I'm the medical director at Larwood Hospital. I'm a psychiatrist, see children, adolescents, and adults.
Stephanie Woodard, Hall County Solicitor General.
I think working for the school system, what I've seen firsthand is students having access to prescription pills that they shouldn't have access to. One of the common experiences that I've experienced in my years here as principal has been the situation where a student's in my office and I'm interviewing them and they admit to swallowing a pill or several pills, and they'll admit that they do not have a clue with regard to what that pill will do to their body once they ingest it. And I've often been shocked and even dismayed by the fact that you'll have kids this age that are inquisitive that will say, I'm willing to try. The kid told me it would make my heart race, or the kid told me it would make me sleepy. And they're willing to swallow it and take it without even knowing how it's going to impact their bodies. And I believe that is the onset of the beginning phase. We have other students that may be in the situation where they are swallowing lots of prescription pills that don't belong to them. But that initial onset of abuse issue, to me, is the fact that kids are willing to try something they don't even know what it is.
We in public health are throughout the community in a number of different endeavors, and so while we may not treat people with prescription drug abuse, we oftentimes see the impact. We have had, unfortunately, on a rare occasion, an employee who's had problems. As part of our role in overseeing the EMS system, we have identified a few people who actually had prescription drug problems that resulted in loss of license. And we probably see some people in the health department who qualify for our services because they've lost insurance or lost a job because of prescription drug abuse.
We see people every day in this office where people have been affected by prescription drug abuse. People come in here seeking treatment for their substance use. They oftentimes are coming in because they have gotten medications such as painkillers or benzodiazepines like Xanax and Valium for legitimate medical purposes, and then develop an addiction to them over time. They start to misuse them, and then they realize that it's very difficult to stop taking them. So they come in here seeking treatment. We also have young people that come in for treatment as well, who are using over-the-counter medications and other prescription drug medicines, and they too have developed problems with them and have maybe gotten involved with the court system.
Based on my line of work and what we see, the thing that is the most dramatic thing that I can recall involves children of the abusers, as well as children who actually use prescription drugs. What we normally see with parents that are addicted is they take their kids with them while they're out committing crimes or trying to score their next dose to feed their addiction, often driving while impaired or under the influence of the drugs. I've seen families which otherwise would be considered normal, functioning families being torn apart by the parents' addiction. I've seen kids taken from homes, placed in foster care. We've worked cases where children have actually been on the side of the road with their parents going to jail while we're having to wait on family friends or other relatives to come pick the kids up. That's been the hardest thing to witness regarding this type of crime.
Over 70% of drug users are employed. So it's not necessarily the person sitting on the side of the street that you're a drug user or a drug abuser. It is the person working beside you in your job, your employee, what have you. Prescription drug abuse adds a whole nother level to that, because the average person, unfortunately, may or may not see prescription drugs as being a problem. In other words, they may have a viable prescription that they got from, say, even their dentist. And if they are using it, when they're not in pain, and or using more than was prescribed, and or sharing it with their wife that has a bad headache that day, that is leaning towards prescription drug abuse. Actually, that is prescription drug abuse. And maybe it's not a problem yet, but if you do that a few times, suddenly there's that change in the brain, and it becomes an addiction issue.
Prescription drug abuse is a real problem, not just in Hall County, I'm sure across the country. But what I've seen is people will go to various doctors, won't tell each doctor what they're getting, get a lot of different medicines. Had several patients to overdose, and several have died because they went to my store and several others, and nobody knew what was going on.
I've seen and witnessed how it affects people in Hall County, the prescription drug abuse problem, mostly through inpatient hospitalizations of people coming in who desperately need help to be able to detox off these medications, but also outpatient. It knows no socioeconomic standard. I've got kids who are from low socioeconomic standard homes to kids that are of homes very wealthy that are coming in, and their lives are being directed in a way that is destructive, and I've seen it tear people apart.
Placing a whole new class of folks in jeopardy for criminal prosecution. Let me give you one specific example, or DUIs, prescription drugs. Prescription drugs have become so commonplace in our community that people who are taking their prescriptions in complete compliance with their doctor's instructions, remaining within the therapeutic course of treatment, are still possibly subject to arrest and prosecution for driving under the influence. We have become so accepting of medications that we no longer question the labels that are put on there, the signatures that we have to place, or the inserts that are provided by the pharmacists, to understand the level of impairment that prescription drugs can have on our reflexes, on our ability to make critical decisions. So that to the point where even if we're operating under therapeutic limits, we might not be safe to operate a moving vehicle. So therefore, I'm dealing with folks who are possibly charged with a crime for the first time in their life, completely unknowingly, not realizing their prescriptions were impairing them to that level.
I believe the key to prevention of prescription drug abuse is going to have to center around education and communication. And I think those are going to be the key pieces, because I don't see prescription drugs going away. I think there's times when doctors need to prescribe drugs with a well-intended purpose. So I don't see prescription drugs going away, but at the same time, I think we have to train our parents and relatives about restricting access, and also about how to discard old prescriptions, because that's what I'm seeing in school, where a kid just in effect gets into a mother's or a grandparent's medicine cabinet, and all of a sudden it's the drug of availability. And so that's how it gets brought into our school system.
I think it probably is education, and when I talk about education, I mean something that is credible to the audience that we're trying to reach. And there are a number of audiences, certainly parents, teenagers, physicians, pharmacists, the community at large, school personnel. I think they all need to know that this is a problem. And the other thing that people need to understand is that prescription drugs, when used improperly, can be just as dangerous or just as deadly as street drugs.
I think for young people and prevention of prescription drug abuse, we need to focus, adults in the lives of these children need to focus on being aware of what's in their own houses, what's in their own homes, and their own medicine cabinets. Kids oftentimes get prescription drugs from their parents' medicine cabinets, or they get over-the-counter drugs at home, and then they take them, bring them into parties, into other places with other young people, and distribute them, and people take them to see what they're like and to see what kind of high they might give. They may not even understand what the drug is or what it will do, but they just take it just to see. And I think people need to understand that they need to lock up their medicines in their homes, or if they're not going to use them, get rid of them, because they're something that can be very dangerous to their children.
I think the most important piece of prevention related to prescription drug abuse is enforcement. Of course, I come from a law enforcement background, and I think that certain help courts would be beneficial for a user. In other words, I think that a true addict or a true user might benefit from a program like drug court, which would give them a chance to rectify their situation. However, for the true dealer, the person that's actually selling the drugs, I think that jail time is the most appropriate place for them.
Preventing prescription drug abuse really boils down to making sure that people in general understand that prescription drugs are drugs. They are safe. There's no problem with getting a prescription for whatever have you from your doctor. But something like Xanax, Loratab, hydrocodone, these things that calm nerves, anxiety, slow down pain, what have you, can become very addictive very fast. To prevent it, you've got to know to only use prescription drugs by the prescription when they're prescribed, and only to the person they're prescribed to. Drug-Free Workplace is a program of the Greater Hall Chamber. It comes from the Georgia Chamber of Commerce, and it's statewide. Employers have the benefit of protecting themselves and their workforce by becoming a certified drug-free workplace. And that way they can test and train and prevent drug abuse, both your street drugs and your prescription drugs, which can be picked up by drug tests.
Well, I think the best thing you can do for prevention is to be educated about the problem and that how to prevent that. People sometimes think, oh, if I go to the doctor and get a prescription, it's okay to take all this medicine. Well, if you're going to several doctors and you're abusing the drugs you're getting, well, it's not okay. Those are very dangerous drugs and can cause some serious problems.
The most important thing that we can do to prevent prescription drug abuse is education and candor between ourselves and our community. We must speak with our loved ones directly, with our care providers, our physicians, about alternative courses of treatment and what role pain medication should play in our lives. Pain is a physical indicator of another problem. Therefore, we should speak to our physicians about what is the real problem and look at other courses for addressing that, whether it's physical therapy, whether other medicinal or therapeutic practices. But we need to have candid conversations with our loved ones as well. Pain medication and narcotic medications are things that should be on a minimalistic course and things that we can look for more for alternative ways to deal with long term. We build up a tolerance, we build up a community acceptance for seeing them, and the availability is frightening, especially for teenagers and other folks not intended for the prescription to get their hands on.
Face it.
Face it.
Face it.
Face it.
Face it.
Face it.
Face it.